Chris Turner. I'm a nurse at LAW Outpatient Surgery. Today I just want to review with you some general principles for all patients that receive general anesthesia or IV sedation following their procedure. Prior to your discharge, you and your caregiver will be given an after-visit summary which will include specific instructions for you. It's very common, though, for patients to have little or no memory of these instructions. This is due to the medications that were given during surgery. It's extremely important for you as the patient to review these instructions with your caregiver following surgery. Because the anesthetics that were given tend to remain in the body for 24 hours, it's important to take some precautions. Don't drive a car, operate heavy machinery, drink alcohol, or sign legal paper for at least 24 hours following surgery. It's important to have a responsible adult with you during the night for your safety. This is not only to allow you time to rest, but also to prevent things like falls, medication errors, or other accidents that could have been avoided at home. As far as your diet is concerned, we recommend avoiding greasy, spicy foods for at least 6 hours if you had a general anesthetic. However, if you had IV sedation, typically anything you're up to is okay. For the patient receiving general anesthesia, we recommend starting with clear liquids and advancing your diet as tolerated. It's not required for all procedures, but typically by the time you're discharged, you're tolerating liquids. We do recommend, again, avoiding greasy or spicy foods for up to 6 hours following surgery. This will help you avoid undesired nausea or vomiting and allow your digestive system time to wake up. Should nausea or vomiting become a problem, we encourage you to stop all intake of food or fluid for about an hour and slowly progress back to a normal diet. Based on the type of surgery you have, your physician may have prescribed nausea medication. This is typically taken only as needed, but be sure and read your prescription instructions. If you receive general anesthesia, it's normal to have a sore throat when you wake up. This is due to the breathing tube that may have been inserted during surgery. This generally does not last long, and most find that both warm and cool liquids are soothing. Following general anesthesia, it helps to take good deep breaths every couple of hours. This allows your lungs to expand and prevent things like pneumonia. Should you develop shortness of breath, temperature 101 or more, excessive redness, swelling, bleeding, drainage of pus from your incision, any uncontrolled pain or nausea, contact your surgeon at the number provided on your discharge instructions as soon as possible. If you feel at any time any problem is life-threatening, call 911 or go to your local emergency room. These are the basic instructions given to all patients having anesthesia. However, it is very important that you review the specific instructions given to you by your surgeon. These will include things like your specific wound care, new medications, and last dose if any was given, your follow-up appointment, and any activity restrictions if required. You may or may not have an external wound, but we would like to share some principles to help you avoid infection following surgery. The single most important way of preventing infections is by practicing good hand washing. Upon admission to LAW Outpatient Surgery, you'll be provided with a packet. This packet contains hand washing tips, fall risk prevention, and a pain scale assessment. Please take an active part in your care by reading all the information in this packet. In addition to good hand washing, it's important to follow your surgeon's instructions. This includes specific wound care, activity limitations, and all hygiene restrictions. Not all patients are prescribed antibiotics following surgery. However, if you were prescribed antibiotics, be sure and take them all as prescribed as directed. In order to heal well, it's important to eat a well-balanced diet. If you're a diabetic, monitor your blood sugars and try to keep your blood sugar below 200. Poor nutrition delays healing. Continue to use antibacterial soaps and avoid reusing washcloths or towels. It's very important for you to avoid smoking following surgery or even exposure to secondhand smoke. Cigarette smoke constricts blood vessels and again will further delay your healing. If you have pets, avoid sleeping with them and contact with your surgical wound in order to prevent a wound infection. The germs our pets carry are usually harmless to us unless we have an open wound. For this reason, always wash your hands after any contact with your pet. The staff at LAW would like to go a step further to ensure you understand your instructions. The next business day following your procedure, a staff member will contact you by phone to check on your progress. If you have any concerns at this time, we will do our very best to help you answer these questions. If it's after 5 p.m., a holiday, or a weekend, you will need to contact your surgeon's office with any questions. If you're viewing this video prior to your procedure, here is a list of some common concerns that need to be addressed with your surgeon before going to surgery. When will I be able to return to work? Number 2, if you know a certain pain medication that does not work for you for any reason, please discuss this with your surgeon. At that point, you and your surgeon together can decide what medication will be best for you following surgery. Number 3, if you stopped any medication, including blood thinners in preparation for surgery, ask your surgeon when these may be resumed. We thank you for allowing us to care for you and your family. We wish you a speedy recovery, and again, thank you for choosing Hattiesburg Clinic.